Hello, friends. The subject of discussion today is Kalika. Kalika is also known as potassium carbonate. It is also called vegetable alkali, which exists in all plants and was originally obtained from the ashes left after burning wood and vegetable structures. Kalika may be regarded as the typical member of Kali group in our homeopathic materia medica. But causticum is also a medicine belonging the same group and which also has the same value or weightage. Potassium salts have some specific action on solid tissue rather than plasma. The blood corpuscles are affected due to the action of Kalika, and anemia also occurs in these patients. The various ligaments are affected and loosened. As a result, ligament disturbances are also seen in Cali-Carbonica patients. The tissues are relaxed, joints give out, and the patient suffers from backache or lumbar, as if the patient feels as if each or her back is broken. The climactic symptoms of Calicar is also important. There is flushing in Calicar as we get in Lakesh also. And this flashing is associated with disturbances of the head, which is characterized by violent palpitation. In addition to the uterus and heart, lungs, pleura, bronchi, and larynx all come under his action. Stitching pain is also very characteristic symptom for Calicar patient. Stitching pain is seen in various organs or region in the body, which is aggravated during rest and ameliorated lying on affected side, which is aggravated during rest and aggravated lying on affected side, not ameliorated by lying on affected side. Early morning aggravation is also a cardinal feature of Calica. The time of aggravation is 2 to 4 a.m. It is a very important symptom of Kali Carb patient. All the sufferings of Kali Carb patient aggravated at front, that is 2 to 4 a.m. Back-like swelling, back-like swelling in upper eyes, that is between the eyebrow and eyelashes, is a cardinal feature of Kali Carb patients. Earlier, I have mentioned that Kali Carb has action on blood corpuscle. As a result, the patient sometimes suffers from anemia. As a result, the skin is milky and there is swelling or edematous conditions in various types. But edema in upper eyelid is a characteristic symptom of chronic patients. It is suited to persons of soft tissues with tendency to be fat. EG swelling is also an important feature of Kali Carb patients. Sweat, backache, and weakness. This trio strongly indicates Kali Carb. The backache of Kali Carb is also very important. This symptom may be associated with menstrual symptom or with various orthopedic issues in the lumbar region. The cardinal feature of this symptom is that the patient feels that the back is giving out. This giving out sensation of calicut is too much important. Stitches in region of kidneys, that is in lumbar region, and right step. Back and legs give up. Pain from hip to knee. Calicut is a right-sided condition in our veterinary America, as like Lycopodium and Chelidonium. Complaints after patient, complaints after intercourse in ladies, complaints after intercourse in men, especially in eyes, weary and sick during and after eating. This is a peculiar and rare symptom and of utmost importance for Kalika patients. If we get in any disease, sleepy and weak during or after sleep, we may use Kalika because it is a strong indication for Kalika. Therefore, we should not forget that sleepy feeling or the patient sleeps during eating or just after eating is a strong indication of Kalika. The mental state of Kalika is one of peevishness, and irritability, easily startled by noise. Fear is prominent, fear to be alone. The patient cannot stay alone in any time. He always wants the pain. So calicar patients are very dutiful and they sacrifice their interests for the betterment of their family. They are very dutiful and they want to be with the family, to be tied with the family, and never want to be detached. Intellect impaired does not care for anything. Indifferent and bodily exhaustion. When questioned, does not know what to answer. The touchiness of this remedy is also marked, cannot bear to be touched, especially in legs and toes. Starts when touched even so lightly, especially in the feet. Calicut acts profoundly on tissues. It causes degeneration of heart and other muscles. It affects the blood itself as well as the circulation, causing anemia and hemorrhage. Fogging of blood vessels all over the body and to the ends of fingers and toes is a marked symptom of calicut. I repeat, fogging of blood vessels all over the body and to ends of fingers and toes is a marked symptom of calicut. A peculiar symptom is sensation as if the earth is suspended by a thread. Sensation as if the earth is suspended by a thread. The digestion is very much disturbed. Flatulence, distension, and constipation is there. Toothache only when eating. This is also a cardinal feature of Kalika. Toothache only when eating. Now, respiratory symptoms. Hoarseness, hoarseness and roughness in throat, sensation of a plug in larynx, dry cough, especially at night, and in evening, in morning with expectoration. Night cough, which is aggravated 3 to 4 a.m. This aggravation time is too much in time. In any disease, when it is aggravated 3 to 4 a.m., we have to think of Kalisa corresponding other symptoms. Or lying on right side, stitching pain in chest. Aggravation, right, right lower chest, and lying on painful side. Better in one climate. Drowsy violinist eating, which I have mentioned earlier, to be remembered by every homeopath, that it is a cardinal feature and a strong characteristics of Kali Carb patients. Now come the modalities: aggravation, preparation, or intercourse, especially in men, and the strategies in ice. In cold weather and puff in morning about few cloth lying on left or painful side. Amelioration in warm weather during day and while moving around. Thank you, friends. Have a good